Hey guys, so my name is Lindsay and I am a dental officer working in Bradford District Care Trust. So this presentation today is on why I love working in community. In this presentation, I will outline a little bit of my personal dental journey and I'll explain the 5 reasons as to why I enjoy my job and why some of you should maybe consider a career like this. But for those of you who know you definitely do not want to go into community, that is fine because this presentation will explain the types of patients that we see, the types of treatment we can offer, so that you have an awareness of what types of patients to refer to our service. So just a little bit about myself. So I graduated Leeds University in 2014. And as a dental student, I was very involved in a lot of youth work with inner city children and young people in Bradford and Leeds. So I always knew that I wanted to use my dental skill to help vulnerable groups. But I'd never heard of community dentistry. And it wasn't until our 4th year career symposium that I realised that there is actually a service out there that is deemed to help vulnerable groups in dentistry. So I knew then that that was the career choice for me. So when I graduated uni, I did the 2-year scheme, which is DCT1 and foundation training at the same time. So it meant that you did max facts 1 week and then you did general practice the other week. And I personally loved that scheme because I was able to connect with lots of different groups, lots of different people. I liked the variety, the change of every week, and also I quite liked it because I was able to maintain my dentistry skill as I was learning the max fact side. Again, everyone is different, and I know some people may prefer more routine or prefer to really get a solid foundation with their dentistry skill first, or even just feeling that maybe it's a little bit more disjointed, but you will know what is best for you. So when I did Max Facts, it was a fantastic opportunity just to learn about head and neck anatomy, oral cancer, to learn about medically compromised patients, and to be able to do lots of surgical extractions and lots of biopsies. So I would strongly recommend it if you are considering a Max Facts year. It's definitely a steep learning curve, but it is a good learning curve. So when I completed my foundation training, I got an amazing job for a great service, and that is being a community dentist for Bradford District Care Trust. And some of you will recognise this clinic because this is where some of the 4th year Leeds Uni dental students do their outreach placements in 4th or 5th year. And this is one of the therapy students treating one of her paediatric patients. So if any of the Leeds Uni students are here on placement, we are more than happy for you guys to ask us any questions. Now I'm going to tell you the 5 reasons why I love my job and why you should maybe consider a career like this. Number 1 and most important reason why I love community dentistry is because of the amazing patients that I get to treat. And it is these patients that make my job fulfilling and so rewarding. We treat patients that may struggle to access a general dentist due to a learning disability, a physical disability, or a complex medical need that requires a specialist input. For our patients, we have specialist equipment such as wheelchair tippers and patient hoist and banana boards to help our patients overcome physical barriers to them accessing dental treatment. In Bradford, we see lots of paediatric patients, either because they are young, they are anxious, or they've got a special need. And sadly, it's not uncommon that we see this, nursing bottle caries. And you know, Bradford, like lots of other cities in the UK, has got a high DMFT, a high decay rate, and a high dental need. So in Bradford in particular, you will be able to use lots of them behaviour management techniques that you have learnt for them paediatric patients. On a daily basis, I see lots of patients that have not been to the dentist in a very long time. And sometimes these patients have high dental decay rates. And the reason sometimes for this lack of attendance is because of they're highly anxious of the dentist or even phobic. So therefore, some of the treatment that we provide these patients can take longer in community because we need more behaviour management and more interventions such as cognitive behavioural therapy and sedation. Also, we are referred children and adults under the care of social care and children and adults with mental illnesses. As you can see, we see such a diverse range of patients, and that is why I love community dentistry. But we also see the elderly patients as well that may struggle to access a general dentist, maybe due to a physical disability or a complex medical need. And this can be patients that have got dementia and include even patients that are having end-of-life palliative care. What I love about community dentistry is that we get to treat those hard to reach vulnerable groups in our society, the homeless, refugees, asylum seekers, patients that may struggle with substance misuse, and we as a dentist get to make a positive impact on their life. And for our team in Bradford, what I love about our community dental service in Bradford is that all of our staff are 100% committed to our patients to deliver high quality dental treatment in a caring and compassionate way, but also to help our patients to manage their dental treatment when they would usually find it difficult due to the medical, physical or emotional need. So that is the first reason, because of the incredible patients that we get to treat. The second reason why I enjoy my job is because it allows you to make a huge difference in society. It lets you treat those hard to reach, vulnerable groups in our community that may struggle to access a general dentist. But also we know all too well in COVID-19 how our British culture is incredibly proud of our NHS key workers. So in this job, it allows you to be a proud member of the NHS team and a proud ambassador of these services. So the third reason why I love community dentistry is because of the huge variety of things that you can be involved with. And for myself, when I was a foundation dentist, I was very used to variety, change, to big teams. So community dentistry, what I love about it is that every single day is different and every single patient is very different as well. I'm quite fortunate because I've been involved in lots in my service. But just an example of what I've been involved with is the general anaesthetic sessions. So we have these for children that may struggle with treatment awake, or very young children or anxious children. So it provides their treatment safely asleep in a hospital setting. Secondly, I've been involved with the emergency home visits. So this is for patients that may struggle to leave their home, but they still need to have dental treatment. And it's always a good one because you may be struggling and dodging some cats and dogs as you're trying to make your way to find the patient. Lastly is you get to be involved with things like going out into the community, into the schools, through things such as epidemiology. So whenever you hear on BBC News that X percentage of 5-year-olds have got dental decay, so that actually comes from community field workers like myself that go into the schools, and we basically record the dental decay rates of 5-year-olds. And we get to do the special schools as well, so providing school screenings for those children that have got additional needs. So you literally are able to get out of the clinic and get into the community setting as well. Also in Bradford, we have got a mobile dental unit. So this is the highlight of my week, and we get to go in, park it in the city centre of Bradford, and any of those vulnerable patients that are homeless or refugees are able to jump on and receive dental treatment. And there is more variety. So in community, you will see a lot of highly anxious children and adults. And in our service, to help them manage their anxiety, we have an anxiety pathway. So this involves inhalation sedation, cognitive behavioural therapy, and some of our clinicians can also provide IV sedation as well. So the fourth reason why I love community dentistry is because of the incredible team that I get to work with. And it is this team that are my work family that help me to enjoy my job. And what I love about our service in Bradford is that it's a huge team. There is over 90 people, so there's always an opportunity to connect with someone new. And we in our service have got so many talented dentists, consultants, specialist dentists, senior dentists that are all there to be able to give you advice. But also we are privileged to be able to have highly skilled therapists and dental nurses that have got additional qualifications. So they can take x-rays, some of them can apply fluoride varnish. So that's some of the reasons why I love the Bradford community. And it itself, what is great is that every single staff member is absolutely committed to putting our patients first and delivering high quality dental treatment in a really caring and compassionate way. This is a small example of the number of teams that I liaise with on a day-to-day basis. I've told you some of the reasons why I enjoy my job, but I am not the only person who loves working in this setting. And I thought it's super important that you hear from some of my colleagues. And these include receptionists, dentists, and dental nurses. And what I love about it is that so many people have commented saying that we are the best team, that they love that we are a family, friendships of all ages. And I love the comment on the top right side that says, I've become more understanding of cultural differences and disabilities. And here are some more comments from some of our team. And I love that it states that we are a multi-talented team, but also I love the comment on the top left side that says, a terrified 5-year-old leaves with a smile and a high five. And that's what it's about. That is why we do our job. That is why community dentistry is so incredibly rewarding and so incredibly fulfilling, because you can impact a patient's life if they are a very young patient or a very old patient, and it just gives you opportunity to impact the society that you live in. And the final reason is the learning opportunities. I personally have been trained in inhalation sedation. Also, there's team meetings to discuss clinical cases, and you can get involved in service evaluations to improve current practice. So if you're someone who likes to learn just like me, then you may enjoy a career choice like this. With every job there is challenges, and that includes our setting. One of the biggest challenges that we have to face is the language barrier. We need a lot of interpreters, and even though this is a challenge, I see this as an opportunity to be able to learn some of the phrases with these languages. Secondly, we get quite a few patients that do not attend their appointments, so this requires a lot of administration follow-up. And also, we treat very complex patients that if our service was not there, they would have nowhere to go. We work closely with patients that have been through traumatic life events, from someone sleeping rough as a result of a drug addiction to someone who's just been diagnosed with cancer, or a young patient that's got a traumatic brain injury. It's astonishing how much hardship these patients have been through. But even though this may be challenging for some dentists, I see these patients as incredible people with incredible stories of overcoming hardship, and they actually inspire me. They inspire me to want to work in this setting, to be able to help them have a healthier mouth, be able to eat better, and be able to smile again. Some of you may still not know what career path you want to take, but in your foundation year you have opportunities to get involved in lots of outreach activities. In Yorkshire and Humber alone, we have got so many outreach opportunities, from Happy Teeth Outreach to Teeth Team to the Dented van. And I personally get to lead the Happy Teeth outreach team. So this organisation aims to educate foundation dentists to be able to feel more confident, to be able to engage with children with additional needs, and to be able to be more knowledgeable to treatment plan dental treatment for these children. So if you are staying around Yorkshire and Humber, please feel free to sign up to the Happy Teeth Outreach Teaching Programme. Just drawing this presentation to an end. So the 5 reasons why I would recommend a career like this is because you get to make a huge difference in society. You get to see a massive variety of patients, and you get to be involved with a very big team that have got lots of skills. Also, you get to do a variety of different things, and of course you get them learning opportunities as well. So that is everything. Thank you so much for listening, and if you do have any questions, please just drop me an email and I'm more than happy to answer any questions.